If it's recurrent, you may need some medications for a short period of time. But once you developed an ulcer, you may have to do a lot of things. Hi, I'm Dr. Deepak Subramanian from Chennai Gastro Care. Stomach ulcers and gastritis, and sometimes people develop mild pain after eating out one day. There's a big difference between all three things. So you go to a very spicy restaurant, you go to a very spicy restaurant where there's a lot of spices involved, you have a good meal. The next morning when you wake up, sometimes you may have a mild pain in the upper part of the tummy, you may feel full. That's a very common problem. That does not mean you have an ulcer. But if the same problem starts to occur on a routine basis, probably 3 times a week, 4 times a week, you may have started to develop what is called as gastritis. If the same problem starts to occur for simple foods, even simple things like non-spicy things, you may have bread, you may have roti, all these things, then you may probably have started developing an ulcer. Now, how can one identify an ulcer? As said before, it's done by an endoscopy. So this is stomach ulcers. Generally, once they have occurred, it will not heal on their own. Between the 3 entities I was talking about, the simple mild variety of gastritis which you may develop after eating a meal, spicy meal outside, may heal on its own. You may not even require any medications. Over the next couple of days, if you have some bland diet, you should be fine. Gastritis, if it's recurrent, you may need some medications for a short period of time. But once you developed an ulcer, you may have to do a lot of things. These lot of things could include food and lifestyle modifications, which is the most important, and supplemented with some medications which may last for about 4 weeks or even 6 weeks. Thank you.